Hello everyone, welcome to I2I Gurukul. Friends, today we'll discuss about the ophthalmic trial frame. Before going to start this today's session, I would like to request you all, please subscribe my channel and hit the bell so that you will get the notification on time. Moving towards the definition of the trial frame. Friends, the definition of the trial frame is the device holds the trial lenses and accessories before the patient's eye during the refraction and visual acuity recording process. Now we have different types of trial frames. First one is full aperture trial frame. Second one is reduced aperture trial frames, and the third one is half eye trial frames. We'll look into the one by one. Moving towards the full aperture trial frame. This is lightweight and non-allergic structure suitable for all standard 38mm trial lenses, and this has a specification of standard axis rotation and temple length and inclination adjustable options are available in this frame, and the interpupillary distance can be adjusted from 48mm to 80mm. Right and left PD adjustable independently from 24 to 40mm. So the independent monocular adjustment for optical centers and vertical and projection bridge adjustment for corrected vertex distances. So this is the advantage of the full aperture trial frame. And this is the lightweight frame, non-allergic structure suitable for all standard 38mm trial lenses. Coming to the manufacturing specifications of this full aperture trial frame, these are it has four lens holders, 3 external and 1 internal. Also you can adjust the bridge height up to 13mm. You can adjust the bridge projection distance, that is adjustable up to the 16mm. Temple length can be also adjusted from 98mm to 135mm. It has external axis rotation is continuously available and adjustable. Scale at 5-degree increments. So you can see in the image, this is the full aperture trial frame, where this is the vertical alignment. You can adjust the vertical alignment, and using these two knobs you can adjust the interpupillary distance, and these are the two knobs to rotate the axis. And along with this vertical alignment, you can adjust the back vertex distance with this knob. Coming to the reduced aperture trial frame, you can see in the image this has a smaller aperture. So the trial frame is an eyeglass frame designed to permit the insertion of different lenses to correct the refractive errors. It has few features we'll go through. This is a durable and light in weight frame, and it has adjustment knobs for the vertical and horizontal alignments. It should have a comfortable nose resting portion. This is readily adjustable and allow the accurate centering vertically and horizontally for each eye separately. So it holds up to 4 38mm lenses for each eye. Accessories may be easily inserted and extracted during your refraction or an visual acuity measurement process. Friends, moving towards the half eye trial frame. The half eye trial frame with the nose piece, we can use this in the children, and it has the PD adjustment option from 54mm to 58mm. Also, it has a fixed bridge or an adjustable nose piece. So, and it available for adult with the PD of 59mm to 67mm. As I mentioned in the earlier slide, this can be used for the children. So this trial frame has 3 pairs of compartments to hold the total diameter of 38mm standard trial lenses. It has adjustable PD from 54mm to 58mm. Also, this frame has fixed bridge and adjustable temple length. and this is light in weight, and this frame is available with metal and plastic material also. The comfort trial frame for a children with the adjustable nose rest. So this is the ideal option for the children. Now coming to the characteristics of the trial frame. It should allow the adjustment for each eye separately, like IPD and back distance adjustment. It should be open, preferably in black in color, so that no reflection takes place during your refraction. It should be adjustable so that the pentascopic or retroscopic tilt can be given during your refraction as and when required. As per the prescription based, you can adjust this frame during your refraction. Axis marking should be easily readable with the high contrast, because while rotating you can notify the exact axis of the cylindrical power. It should be thermostatic, stationary. It should be light in weight and non-allergic material. It should be non-corrosive, long-lasting material, and it should be firm in its shape. The distance between the compartments should be such that the lenses do not get rub each other and get scratched, and not too far that the air gap is formed in between. Especially, please keep in mind that while doing the high prescription or an high refractive error refraction, you can use the high powered lenses in the posterior compartment, and the lower power prescription lenses you can put in the anterior first compartment. So the trial frame should be open so that we can rotate the axis easily with the circular opening in the center. It should be adequate and should align with the eye. It has two vertical markings and two horizontal markings, which are used to see whether the trial frame is in the center of the optical axis or not. It should be have an adequate field of view, and the edges should not be very sharp, such that they can injure to the patient while wearing the trial frame during your refraction process. Friends, moving towards the construction of trial frame. The weight of the standard trial frame should not be more than 30 grams. The sides of the trial frame, it is usually made up of stainless steel, so it is non-corrosive material. Parameters does not change because it is a thermostatic material. It has library type temple so that it can fit every patient, and also they can adjust the vertex distance anterior-posteriorly on the face. Trial frame has a central diaphragm. It should be sufficient for the visual field. The diaphragm diameter is 2 centimeter, that means 20 millimeter. Okay, the trial frame has 4 markings on the front surface, 2 horizontal and 2 vertical lines, which are indicates the center of the trial frame, so that the trial frame is aligned properly with the center of the pupil during your refraction process. Friends, as I mentioned in the earlier slide, these trial frames have adjustment vertical as well as horizontal. For the bridge, to raising it up and down, we have an vertical alignment adjustment knobs on the trial frame. Similar, we can modify or adjust the interpupillary distance as per patient's need. We can align the optical axis and the trial frame axis, and we can manage the interpupillary distance adjusting the IPD. Friends, before going to proceed with the refraction or an visual acuity recording process, you need to remember few points regarding the trial frames. Those are, the first one is there should be no tilt in the trial frame, otherwise the astigmatism may induced. So the trial frame should be straight or an well aligned. The axis should be written in properly so that you can read easily during your axis identification or rotating the axis during your refraction process. It should be checked with the dial indicating the axis is truly positioned. A mistake can or may occur during the axis of cylindrical correction. Okay, and the axis is anti-clockwise for the both eyes, and the axis marking dial is present only in the half part of the trial frame, that is on the nasal side. Friends, this standard trial frame has 4 compartments on each side for each eye. First compartment from the wearer's eye. It is used for the higher spherical power, so that the effective power does not change during your refraction. Also, this will help you to avoid the magnification or magnification during your refracting process. Second compartment is for low spherical lenses, and the third compartment is for cylindrical lenses, so that the axis can be easily read. It is properly fixed so that the axis does not get changed during your axis rotation. Okay, and the fourth compartment is made up of 3 screws for accessories like occluder, pinhole, Maddox rod, red and green filters, etc. Friends, coming to the end of this today's topic, so I would like to thank you all for watching this video. Please share this with your friends and don't forget to like, share and subscribe to my channel. If you have any comments or suggestions, feel free to comment. Be in touch with us to learn new things. Once again, thank you for watching.